Hello, our listeners at home. Welcome to our next edition of Medics in Tech podcast. So we've been doing this for a while now. We've interviewed quite a number of people working in health tech, founders, and even employees, just people who have been able to transition their work experience now from probably working in the clinical setting now into health tech startups, and they're doing very well. So what we'll try to do with this podcast is to introduce you to um, various opportunities. We discuss with people who have experience so that you can actually have a glimpse of what it really is to actually be in health tech, and then how you can actually channel your course on probably maybe having that as a side hustle or having that as a main hustle the next few months or years. So my name is Gabriel Oke, and on behalf of the Medics in Tech team, I welcome you to this edition. And on this edition, I have an awesome person. He's a mentor. We've worked on various projects together. He has mentored quite a number of people. He has worked across countries. He has worked on different projects. So when we're drafting speakers, we feel like we've interviewed a lot of young people actually. So we feel like we needed someone who is elderly in the global health space so that you can have a glimpse of that that overview of like the last 30 years of of the old space of health tech, from just just using cloud computing, trying to build databases in hospitals, from just paper and pen documentation now to us having mobile apps and all that. So so that we can have a glimpse of all that. So yes, that's a brief bio of our speaker today, our Dr. Ifeanyi Nsofor. But that's my own view. So I want you to introduce yourself as well. As a global health, I know you are into global health equity and various advisory boards and all that. Let's meet you according to you.
All right, thank you so much, Gabriel. You've succeeded in making me feel old, or at least account for or at least account for my gray hairs this morning. So to be honest, first of all, thanks for having me speak. I think it's always a great thing to share ideas, share lessons learned. Now, I like to describe myself as a global health equity advocate, because I think everything really rises and falls on health equity, whether it's tech in health or health financing or access to vaccines. We need to build everything around health equity. Or like people would say, we need to center health equity in everything that we do. So I think that's how I like to describe myself. For now, maybe okay. As we continue to discuss.
Okay, good. All right, so let's have an understanding of the little impact, or I don't know, maybe it's major, you would describe it, of health tech when you were still in school, when you were doing your clinical posting in the hospital and all that. Like, what was it like for people like us that we are young? We can't even fathom some things now, because there are a lot of things that technology have taken, over now. So let's have an understanding of, a summary of how it was like when you were still a medical student.
Okay, well, let's also put it in context. I left medical school in 1998, so I'm really an OG in the space, like they say. And when I was in medical school, to be honest, most of our record keeping was paper-based. I'm sure within the management office, of course, they had computers, for all sorts of issues. But if we focused on records of patients, they were paper-based. We needed to clock patients, write them down, put them in patient folders. Patient folders were in the records department, were in the wards. Everything was paper-based. And for me to look back now and just also look forward and see how, back in my school where I trained and so many other hospitals in Nigeria, when you now have electronic medical records for, documenting your patients, you see that, we've really come a long way.
Okay. Yeah. All right. Thank you so much. Okay. So now let's talk about the advent of AI now. I mean, how would you describe your interaction so far? Like, would you say you're surprised? And what would be like, or let me see, what has been like the most interesting thing for you over the last 5 years? I think the whole COVID thing brought us into a new world, a new normal and all. So what has actually been like that highlight for you in terms of tech impacting health?
Well, I think on the global level, there's no doubt that AI, has made a huge impact within such a short time. In fact, the way that I would describe AI is like an assistant, that helps you gather information as quickly as possible for you to make decisions as quickly as possible. Of course, AI has also been deployed into, diagnosis and all sorts of things. But to me, in the work that I do, I look at AI as, that dependable assistant that, of course, you still have to look over its shoulders to make sure that information that you get is accurate, and meets the needs, your needs, for at that particular point in time. But beyond that, if I go, say, back to the last 5 years, for instance, in Nigeria in particular, I think for me is seeing more people, emergence of more health tech people interested in solutions that will improve health for the majority of Nigerians. And several of them come to mind. So for instance, if you look at Wella Health and how they are using technology to improve access to healthcare through providing health insurance for people. I look at Help Mom using technology to improve maternal, newborn, and child health. There are all sorts of initiatives, to be honest, that have come up that have really made access to healthcare much more seamless. And like I started, has centered health equity in the work, that we do to improve healthcare, because I think tech is a great leveler, makes access much more available to people who otherwise have been neglected over the years. Sorry, before you ask the next question, are you hearing any background noise from my end? No. Okay, go ahead. I think you're on mute.
Thank you so much, and I'm happy that you mentioned some health tech startups like Help Mom. We've been trying to get a hold of some of these people, but we're still in talk with them. But and the way I would describe some of these things is like there's a stage where they are just ideas in your head, and then they get to be known by people, and then before you now start becoming like that very impactful, like it's in stages. So not looking at just the overview now. Let's look at the work that you've done. In terms of hackathons that you've probably championed, as I'll say. So what was actually going on in your mind in those times? I think there was a time you even had I think during COVID, there's this tech award. I don't know that you got because of some of these impacts. Like, what was going through your mind then, and how do you go about generating the ideas of those hackathons, and how do you even select, like, what do you prioritize?
Yeah. Okay, so I think for my experience with hackathons, so of course, until 2021, I was Director of Policy and Advocacy at Nigeria Health Watch, which is Nigeria's leading health communications, health advocacy non-for-profit, and also the CEO of Epi Africa, which is a sister organization focused on healthcare consulting. So what we did in 2016, Nigeria Health Watch usually has, its largest conference is the Future of Health Conference. I think the next one is slated for October, November this year. Every year, Nigeria Health Watch would agree on a topic for the Future of Health Conference, and then invite experts in that particular area to come and discuss, come up with ideas. Our 2016 conference then was titled Health Meets Tech. And as the name goes, it was our attempt to say, how do we bring health and tech people together to see if we can really engender, discussions, but beyond that also collaborations to come up with relevant health tech solutions for Nigerians in particular, and of course, Africans in general. We were lucky that in our 2016 Health Meets Tech, Future of Health Conference, one of our speakers then was with Facebook, a Nigerian with Facebook. And at the end of it, Facebook decided to support us to go beyond a talk shop, at a conference, to actual hackathons. And that's how come we now started the Health Tech hackathons implemented by Epi Africa. The grant we got from Facebook was for us to organize 3 hackathons at the first instance in Nigeria, Kenya, and South Africa. Although as at 2021, we had organized about 8 hackathons in the same 3 countries, but the bulk of it in Nigeria. Our first hackathon was in Nigeria, so going back to the aspect of your question on how did we operationalize it? So first of all was understanding that in our name, Health Tech, we brought the health expertise, and we needed tech expertise in order to make that work. So for every hackathon, depending on the city where it's held, we will identify a tech partner. Our first hackathon was in 2017. Our tech partner was in Lagos. Our tech partner was the Co-Creation Hub, CC Hub. All the other hackathons we had in Nigeria, were in Abuja, and our tech partner was Venture Spark in Abuja. The hackathon we had in Kenya was with iHub Nairobi. The one we had in South Africa was with Impact Hub Joburg. So we needed that partnership to at least satisfy that name, Health Tech. But beyond that, in now making the hackathon work, of course, we also needed other partners that identify with the theme of the hackathon. So for each year, we decided on the theme depending on what, one, the prevailing issues in health were. Second, depending on the partners, that wanted to support us on the hackathon, depending on what they were interested in. Our 2019 hackathon, for instance, our major partner for that was Pandemic Tech based in Austin, Texas, and they were interested in infectious diseases. So for that particular one, we focused on infectious diseases. So we gather partners beyond our major partner, other partners who wanted to support the particular hackathon. Then in partnership with our tech partner, we will now advertise the hackathon through them to the tech community, because if it comes from the tech partner, people in our tech community, in the tech communities, will take it seriously. Then of course people will apply, we'll do a shortlisting, and now decide on people that we're inviting for the hackathon. But beyond, once we now do the shortlist, the next phase of the hackathon was to identify who will be our judges on the day. It's usually a weekend event, Friday to Sunday. Who will be our judges? Who will be mentors? What prizes would we give? What kind of support would the prizes include beyond monetary compensation? Yeah, and that was how, that's really a summary of how we made the hackathon work. And for us to have organized about eight hackathons from 2017 to 2021, I think was quite unprecedented. And, there are so many lessons from that, from those experiences. And I need to give credit to my colleague then in Epi Africa, Ugonna. Ugonna was really, also the person was like my second, my go-to person who was, managing those hackathons and pulling a lot of things together.
Okay, thank you so much for that. Yeah, I think because we have a lot of questions, and if you want to go direction of all the questions, it may take 2-3 hours. So I want us to stick around hackathons, right? So now, and that will be around startups and starting up ideas and all that. So what would be your ideas to people who are probably at the ideation stage, who are building something for Global South now, trying to build something in resource limited settings where there isn't so much support and all. So what would be your advice to startup founders and founding members of various initiatives that we're having now?
Okay, in our hackathons, usually once we shortlist people, before the hackathon, we used to have like a webinar with them for them to ask questions, for us to prime them and things like that. And one of the things I used to tell them then was, you need to focus on solutions and not necessarily technology, right? What problem do you want to solve? Yeah, so once you identify that problem, you see that problem is evidence-based, it's a huge issue that you can really tackle, then you now begin to ask yourself, what are the ways we can tackle this problem, including tech? Think about it. The largest, probably the largest tech firm now providing solutions globally is Amazon. Or what does Amazon do? Amazon sales is almost like a grocery store where where people you can order things and they deliver. So and knowing that if you go back to the story of the founder of Amazon, he started by selling books. He needed to solve a problem of people having access to books. So for me, the first thing is that what is the problem you're trying to identify or you're trying to solve? When you now identify the problem, then what are the solutions? Then in identifying those solutions, doing a hierarchy of needs, you can now say, okay, part of the solution will be for us to deploy tech, and the tech could be, for instance, you want to use WhatsApp, you want to create WhatsApp bot, you want to create a website that is very interactive, you want to create a platform for people to sign up for different issues. You need to, create a platform for people to improve awareness, of people about different issues. So is that problem first? Because if you look at major tech firms that are solving very important problems, you see that their tech solutions are not too complicated, but the problems that they are solving are very relevant problems that people face in their communities. So for me, that would be the basic advice beyond before you start saying, okay, I want to use this tech solution to solve a particular problem.
Okay, I think I agree with you on the relevance of the problem and then the simplicity of the solution. It must be very simple. Yeah. And I also agree with you the fact that founders and anybody championing anything should focus on the solution, because sometimes I feel like there are some apps, when you now finish building the app, you now realize that maybe a website is even enough to solve the problem rather than building the app. So that's to just focus on actually solving the problem than actually creating something savvy and techy. So I think that really makes sense. So let's take it to thought leadership now.
Yeah.
What do you think are the challenges of us really taking advantage of technology of some of these early startups, in solutions in Africa and global South at large?
So for that, let me start with two quotes from the Op-Ed Project. The Op-Ed Project is based in New York, women-founded, women-led organization that they taught me to be a thought leader. So I usually, quote them. Two particular quotes. One is that whoever tells the stories writes history. And the second quote is that the stories that we tell is the world that we live in. So because of these two quotes, people who, if you're in health tech, you need to really embrace storytelling and using different platforms to tell your stories. Of course, you could write if you want to write. You could, let's say you have a website, that's your solution to the problem. You could have a blog page where you tell, stories and everything. Or for me, I think the basic platform for storytelling, especially for tech and health tech entrepreneurs, should be social media. Because think about it, more than 3 billion people are social media across the world. Surely that's about 40% of the world's population. If 40% of the world population are using social media, then it must be important. But having said that, let me quote, one of the leading American, thought leaders on social media use, Eric Coleman. He says that it is no longer whether we use social media, but how. It is the how that matters. What is it you want to use social media for? And if you're using social media, which of the social media platforms, should you focus on, based on the population that you're serving? Which of the social media platforms should you focus on based on the kind of people who are more prevalent there, so that they can carry your message, to the population that you're serving. So, and for me, when you talk about social media in Nigeria, for instance, you need to talk about Facebook, because probably about 50 million Nigerians are on Facebook, which is like 25% of our population. You talk about Instagram, because again, they are the same platform in a way. You can also integrate both of them, what you're doing. You need to talk about WhatsApp. Think about it. If you've not received a WhatsApp message from your aunt in the village, then that means you're not doing something right. People are there. You need to also look at TikTok, because that is where the young people are focused. But in all these different platforms, you also need to understand how they operate, such a way that you can maximize, your reach and the way that you deploy your information. But ultimately, going back to that quote of the op-ed project, whoever tells the stories, write history. Telling your stories beyond the, expanding your impact, to me, most importantly, is to ensure that you're part of history. Because when you tell your stories, for instance, you don't know who it is that is going to say it. You don't know who it is that will come across it. You don't know how that would even help, advance what it is you're doing, and the people who have similar interests. So for me, storytelling is a must, for health tech entrepreneurs. And I hope that more people would drop the fear and apprehension associated with storytelling and embrace it more and use social media, because, hey, social media is tech. And if you're working in tech, you should use those platforms.
Okay, so I think I agree with you. So let's just the remaining few minutes to talk about the future of health tech now. So what, in your own opinion, what do you think the direction is? What do you think we'll see in the next 4, 5, 6, 10, 20 years in the health tech space? From Global South now, what direction do you think we're going?
Okay, before I dive into global tech, at least let's look at globally. Globally, for me, AI obviously is the place to be, and it's going to dictate how the tech, community operates going forward. And because of that, us in the global south, from the global south, have to really tap into that. But having said that, we know that, we have different issues with, say, people having access to smartphones and things like that. And even if you look at Nigeria, not up to 20, I think about 20 to 25% of people that have mobile phones, have smartphones. So because of that, it's really 25% of the people who ordinarily you want to reach, that have access to smartphones. So because of that, let's focus on interventions that can reach people through those basic attributes of the mobile phone. SMS, using bots deployed through SMS or deployed through WhatsApp. WhatsApp is a low-hanging fruit for a lot of people in our communities. And also, let's remember that, and I don't think a lot of people think about this, let's also remember that radio is tech, right? Radio is tech, because apart from it being a technology that people can, tune to through a radio, lots of radio platforms also operate online now on social media. So to me, it's also the future, because a lot of our people listen to radio, have radios and things like that. And of course, we cannot forget social media. Social media will keep increasing. And probably, I also want to see a lot more of our tech entrepreneurs maybe begin to think about social media, our own indigenous social media platforms that will take into consideration the challenges that we have with connectivity, internet speed, and things like that to really increase access for our people.
Thank you so much. So I know you have another meeting very soon, and I don't want us to talk so much on various things. I want us to just focus on the hackathon, future tech, and the challenges for now. So in the coming months, I will reach out again when we have another episode, because I know there's so much to get from you, not just tech. Equity is there, global as a topic on itself is there, and various projects you've worked on as well. I think Ebola, there was a time you were part of that response then. So there are a lot of things to actually learn from your wealth of knowledge. So thank you very much for every time. You're always responding whenever I reach out for things like this. So I'm really grateful for that. So yeah. So any final word from you?
You're my Ghana. If you say I should come, go. I go. I'm loyal.
Thank you so much. Yeah.
All right.
Until next time, sir. Thank you so much. Bye.
All right. Take care. Yeah.
Bye.
Bye. Yeah.